When you don't have a stable home, you can't take care of your health. Because of exposure to the elements, violence, substances, and abuse, people without stable housing land in the emergency department and the hospital on a chronic basis. They get treated, they get released, but because of what they're dealing with outside the hospital walls, they end up right back, and this time the situation's worse. Let me tell you a little bit more about one situation in particular in downtown Los Angeles with one of Samaritan's biggest partners, Common Spirit Dignity Health. In LA, they've got about 3,500 patients on the street that cost them $2,000 per patient per month, or $7 million in total in unreimbursed care every month. To better support this population, they set up this contracted network of community based health centers and clinics that were much better equipped to handle the ongoing behavioral health and social determinant challenges this patient population faced, from mental illness, substance use, income, and housing related matters. The hospital would create a referral for one of these blue dots every time one of those 3,500 patients would present. The challenge was essentially because of what the people are dealing with on a daily basis, only one out of five of those referrals actually ends up getting used. That means that 80% of those referrals don't end up creating ultimately any value for the patient, the provider, or the health plan. So, what we have done is given 200 of those 3,500 patients a 12-month membership to Samaritan, where patients get one of those fancy cards you see there and are able to set goals with a caregiver using our platform. They're able to share goals and then start to get funding plus social support for taking bite sized action steps towards those goals. So, practically, one of the first action steps is almost always to complete that referral from point A, the hospital, to point B, the community health center. And folks, yeah, get 5, 10, $20 for completing that action step. Really, from there, they start getting funding and social support for taking other action steps, like submitting a job application, meeting with a housing navigator, getting their dialysis done at a clinic this week instead of ending up in the hospital next week. We are able to help those members use those funds to meet survival needs as well as strategic needs, from bus fare to footwear to uh, debt payoffs to deposits, really anything you can think of. We have seen very quickly the fraction flip on itself, where one out of five care management steps have turned more into like four out of five care management steps being taken. These these action steps have led to people being employed, to moving into stable housing, and most of our participants have materially improved their access to primary and specialty care. From a clinical standpoint, this has driven significant outcomes in terms of reducing hospitalizations and costs, ED visits. And when compared to a lookalike group of patients that didn't have access to Samaritan initially, there was a $5,500 per person per year difference in cost, uh, which is significant when our software pricing is one fifth of that. And so this data plus other deployments we've demonstrated have now helped Samaritan get into contract with national payers who are trying desperately to better serve and engage their most vulnerable populations. Tens of thousands, hundreds of thousands of people, facing the worst that this world has to offer. And so, we have these opportunities with Elevance, Molina, Humana, Aetna, Centene, and soon United Healthcare as well, in the cities you see here, to better support their most vulnerable populations in taking, action steps today that can lead to outcomes tomorrow and over the course of a lifetime related to stable housing, income, and health.